All right, so we'll get started. There's some sign-up sheets going around if anybody just walked in. Flag one of those down. And also make sure you fill out the little eval form and hand it in to me before you all leave the room, if you wouldn't mind. All right, so we'll get started. So Dr. Keli Mu is an associate professor and the chair of the Occupational Therapy Department at Creighton University. Dr. Mu is a native of China and completed his professional and higher education training in the USA. He joined Creighton University in 1998. In 2008, Dr. Mu launched the China Honors Interprofessional Program, or the CHIP program, in which faculty and students from the School of Pharmacy and Health Professions and School of Nursing travel to China to provide interprofessional health services to patients in the hospitals. Currently, CHIP is in the process of being expanded to pharmacy and medicine. And presenting with Dr. Mu is Professor Angela Patterson. Professor Patterson is an adjunct instructor in the Department of Occupational Therapy at Creighton University. She also serves in the role of academic fieldwork coordinator, collaborating with interprofessional clinics nationally and internationally for student experiential education. Professor Patterson is currently a student in the Post-Professional Occupational Therapy Doctor program at Creighton also. She has focused her studies on global healthcare and interprofessional education. Professor Patterson has been an instructor for the China Honors Interprofessional Program for the last 2 years. Together, Dr. Mu and Professor Patterson are here to share their international immersion experiences. So if you'll please help me to welcome Dr. Mu and Professor Patterson.
Thank you, Laura, for the kind of introduction. Good morning, everybody. Welcome, especially a Saturday morning. Welcome to this session. It's really a pleasure to be here. Angela and I are going to share some of the experience we have regarding interprofessional education and interprofessional practice. It's one of really my kind of a research interest and also my passion as well. So we know that a growing body of literature has demonstrated that interprofessional practice, interprofessional healthcare services is beneficial in multiple ways. We know that will be the services will be very effective, efficient, cost saving, but also increase patients' satisfaction. We know that research literature has demonstrated that that's quite a given. So when I talk about interprofessional services, I always remember one incident I encountered during my training. When I was in school working with a case with a severe disability, I still remember her name and her face. She has a severe disability. She's arbitrary. She's non-verbal, like using non-verbal, non-symbolic communication, like a gesturing and vocalization and so forth. So one thing like the OT tries to work on is on the grasp and the release skill, right, hand manipulation skill. So we know that we have to hold on objects, right, in order to function, in order to participate in daily routine, right, like ADL, eating. For kids, play, right, is their function. So you have to really to hold on something in order to play with and manipulate it. So OT tries very hard to work with her on this because she tends to just grab something, release right away. And then, there's IEP goal related to that, and then OT comes, 3 times a week to work. In the meantime, it's a season for the Special Olympics, and then the PE, the educated teacher tries to have a kid participate, her name. What she's trying to do to have a kid, like grabs the ball and then throw as far as she can. So you think about that, right? So the OT try to have the student keep, to hold on as long as possible. But then the PE teacher asked her to pick up a ball slow right away, as far as possible, right? So we think about without talking to each other, without interprofessional practice, our services can be very fragmented, right? Can be isolated, sometimes even contradictory, just like the example we said, right? So without talking to each other. So I think we really know that a growing body of literature, which means that not just one or two research studies, right? Really demonstrate that interprofessional practice is beneficial, right? The triple aims in healthcare. So there are different ways to do that, right? We know that. So interprofessional education can be carried out in the didactic coursework, in the hands-on laboratory, right? In clinical, experiential learning, and service learning as well. What we are going to talk about this is what we did is the interprofessional education, interprofessional service through an international immersion experience. So that's what I'm going to share. That's what we are going to focus on this 45 minutes. So we know that I'm from School of Pharmacy Health Professions. We really have a rich, long history in terms of international, interprofessional experience. So we know, in addition to everything, we have been doing as a university. For example, ILAC, right? So that has been ongoing for a while. So I'm so glad to see Andy here. He is our kind of important and instrumental stakeholder in this process. And then we have a long history, like we have a collaboration with China, with Korea, with Japan. We also have been reached by other countries like Australia, New Zealand, and then Netherlands, and so forth. Of course, like I said, the ILAC program has been ongoing for a long time. So in terms of the CHIP, professional honors, this international honors, interprofessional program, we kind of started in 2000. The formal launch is in 2008. However, we were approached by somebody through personal relationship in 2005. And then at that time, in our school, we still, Dr. Bradbury is still our dean, but now he's the interim president until July. And then Dr. Copper was the chair, so we had the first visit in 2005. And then basically in 2008, we started a program. It's called the CHIP, China Honors Interprofessional Program. So basically, in the CHIP program, a hospital in China, they host us. We use a fall break that students, their study, their learning, their routine, right, cannot be interrupted. And then we bring a group of OT, PT, nursing, faculty and students to go there for this immersion experience. Prior to our departure, we have lots of seminars to prepare the students and the faculty to work on assignment in interprofessional format to get ready for the trip. So when students, participants comes back, and then we also have a seminar. They share their experience with faculty, students, staff across the health science schools. So in interprofessional nature as well. So, and then with that, I will turn the floor to Professor Henderson. She's going to share with you exactly what we did during the preparation.
Good morning. Can you hear me okay? Okay. Part of the mic is that they're recording this too, so that's why we're using the mic. So yes, I've had the opportunity to be one of the instructors for the CHIP program over the last couple years. And when I say one of the instructors, our interprofessionalism really starts at the faculty level. There's nursing faculty involved, there's occupational faculty involved, and physical therapy faculty involved, excuse me. And so really our planning on, okay, how are we going to, go about CHIP this year, with the culture of the students we have, the changes we want to incorporate, where we're going, and what the plan is. We kind of start doing that the summer before CHIP starts. And CHIP, like Dr. Moose said, has been in the fall right now over fall break. So we have to come together as that interprofessional team, get to know each other, get to know each other's teaching styles, so on a different level of professionalism, and then be able to present this, to the students from all of our perspectives, because we really want us to be able to model that teamwork and that interprofessionalism for them, so they understand how we work together. Which obviously all of us have actually gone on CHIP, have also been in practice in the clinics and the hospitals, somewhere along the lines of our experience. We've been in practice together and have had to work on that interprofessional team. But I know from my background and my education, my interprofessional learning curve happened when I was in practice, not necessarily as much in the schools back in the 1990s, just because interprofessionalism wasn't as big of a focus as we have now, which is, I think, is wonderful, because from some of the outcomes and some of the feedback we've gotten from our students that have gone, they now can see as they enter into practice how that experience prior is going to benefit them. So our CHIP objectives, we usually kind of one off of 3 objectives. It's cultural competency, so that cultural immersion piece. How do you get into a completely different culture that is not familiar to you, and then be able to practice your skills, your knowledge of healthcare from the American perspective in a country that has a different perspective of healthcare and different quality of healthcare, and just a different dynamic of the clinics and the hospitals and the patients. So that's a focus. Interprofessionalism is a focus. But, as interprofessionalism, you also need to develop your professional skills as well. Communication, being able to approach other therapists, other clients, the medical team as a whole. So they can really get that professional piece along with the interprofessionalism. And then the cultural exchange kind of comes into effect here and while we're there. And so there's many opportunities that get created that we also can do research as well, and we can collaborate on that research. So now all of a sudden our interprofessional team has now grown to include health professionals from another country as well. And Dr. Moo will go over more in detail some of that research piece of that. We also really look at a reflective piece, because we do want the students to be able to have that ability to kind of have that personal understanding of their own as to, okay, what am I learning? How is this affecting me? How is this experience going to affect me in my future practice? But then be able to share that with others on the team. And sometimes in interprofessional education, that can be a little bit difficult to do, because you're used to sharing your thoughts, knowledge, experiences with clients, with people that are in your same profession. But now you have to share those thoughts with people outside of your profession, in nursing and PT in this case as well. So we really look at that reflective piece, and being from the Ignatian values, we do have them focus on cura personalis, men and women for and with others, treatment of the whole patient, whole client, and how that relates to the whole experience, which also becomes part of that cultural immersion piece, because that's not necessarily the approach the Chinese culture takes to healthcare. So it's a big learning curve there as well. So CHIP, as Dr. Moo said, was kind of the inaugural year was 2008, even though they had been working on it prior to that. And the last time we went was this past October in 2014. And so over the course of that time, 20 faculty from the School of Pharmacy and Health Professions, and then Dr. Fry, who's our health sciences dean at the time when it started, has been able to participate in CHIP. So it really has broadened throughout all of our school. And 40 students have been able to participate. Those students have ranged from our entry-level OTD and DPT programs, and also we've taken students from our post-professional OTD program, and nursing students this past year were from the DNP program. And so you really, some of these professionals and students going have a higher level of knowledge, which can be beneficial because even this past year with the DNP nursing students, they're in practice. They're working right now. One was in an ER and one was an OB nurse. And so they were having that daily, I shouldn't say daily, that weekly full-time patient interaction compared to our entry-level PT and OT students that have just maybe had some clinical experience. So even that knowledge that they could bring to that team was beneficial in learning how to communicate that knowledge and say, hey, in my experiences, this works, and how can we work on this together? So it really has involved quite a few people. So the CHIP course specifically, as Dr. Mu said, we do about 5 or 6 seminars before we actually leave on the excursion. So starting at the beginning of September, we meet for 2 hours a week, and we focus on those objectives and to get everybody prepared to go on this immersion experience. So again, some of the things we're going over in the classroom is we really go over the Chinese culture, their beliefs, expectations of what you will see when you get there. We use many different learning tools. We use, research studies. We use YouTube videos. We try to kind of bring in all different perspectives. We also use Dr. Mu, who's been there many times and is a native of China, to get that perspective. And then there's always faculty involved that have been there as well. So you kind of also get that perspective that I've been there, but I can't say I'm an expert because I haven't lived the culture. I've only had these short immersion experiences. This past year, because of our collaborations now with China, we were very lucky because we had a PT student and a pharmacy student from Nanjing here on campus with us that could come to class and allow our students to interact with them and ask them questions about the healthcare culture. We also had a scholar from Hebei, the province that we go to, in the classroom with us prior to leaving, so he could actually give that his perspective of being within the medical facilities that we actually were taking the students to. So that helped kind of that cultural knowledge piece that they learned before we went. Again, we go over their traditions, their customs. I kind of talked about that reflective piece. In this piece here, we also involve our chaplains because we think that they can offer that support and be that sounding board if someone has fears or anxieties about the cultural immersion piece. We haven't, thank goodness, had the experience, but if our team isn't meshing well before we go, we can bring in the chaplains to help us kind of problem solve through some of that group work, teamwork, and how do we get these guys to kind of mesh together before we actually go on our experience. So the chaplains actually came in and provided us a little more expertise knowledge on reflection as well. And then what that reflection led into is one of the major assignments that we had this past year, which was a portfolio for the students. So the students were required to enter in any of the assignments we had due for the course into a portfolio, but they were required to do a daily reflection why we were in China. No matter if we were flying on the plane, the time to take and get there, or if we were in the clinic, they reflected on each piece of that. And part of that reflection, we gave them guiding questions, but we also left it open for them to put their own input into, what were they getting out of the experience. And all of the portfolios that we had, come back to us afterwards, all said that they gained that interprofessionalism, teamwork, cultural awareness, ability to use the skills that they've learned in their future practices. So it was a very common theme throughout the PT, the OT, and the nursing portfolios. There was a couple times in our experience this past year where nursing got separated from the group because they wanted their expertise in the ICU or they wanted their expertise in another part of the hospital. And they kind of kept PT and OT in just the rehab facility working with the clients. So there was some separation, and it was interesting to find, after that separation, that the students actually came back and said, we wish we could have been in those units together as well to see how they functioned as a team within the different units. So even though they both appreciated those separate experiences, they were realizing what would be beneficial about an interprofessional team even when they weren't all together as a team. So that was really pretty cool to realize that as well. And then after the 10-day experience, they come back, and we usually have one more seminar class, and that is kind of a debriefing class where we just kind of ask them certain questions. You know, what did they get out of it? What do they now want to ask us after the experience? We ask them, what do you think we need to change and what would be more beneficial in teaching this class in the future? So we get that feedback in a live seminar, more discussion group type of situation. But then we also get that feedback through an assessment we do at the end. We have them answer a written set of questions where they're providing us that feedback. So every year we can take that and kind of move on. And this year we're taking all of that knowledge, and then hopefully by the spring of 2016 we'll have pharmacy and medicine moving into this whole interprofessional team. So we're hoping that all these pieces we've learned from PTOT nursing over the years will help us transition into a smooth combining with medicine and pharmacy as well. And that's one of the challenges that we see over the course of the years of CHIPS is the number of students and the number that people that actually go on the experience can change. This year we had 8 students. Last year we had 4 students. And so just by the mere fact of doubling the amount of students, we as interprofessional faculty had to kind of figure out, okay, what do we need to do in order to move forward with a larger group of students, and how are we going to get them to mesh? So, and a couple of our things we decided to do before the seminars to get the group more as a team, we actually did teamwork building skills within some of the seminars. We had them do activities together that we kind of stepped back, and as a team they had to problem solve through. And this was before they really even knew each other. So right from the get-go, they were introduced to each other. Okay, we need to start working as a team. And they meshed really pretty quickly. As faculty, we could start seeing the personalities come out in the students and where we needed to build students up and what skills we could pull out of certain students to really help lead the team as well. So that was really beneficial to us. A couple other things we did ahead of time to kind of build that interprofessional team before they were in a clinic together working as a team is we kind of did discussion boards as well. Another caveat we had to this group this past year is one of our students actually is one of our Alaska cohort students, so he lives in Anchorage. And so he was Skyped into lectures or WebExed into lectures. And so then we had a problem solve, how do we create teamwork when we're not all in the same location? And so we tried to, and I believe that it was successful. We did it through discussion boards. So we did one discussion board where I actually led that discussion board. So I was asking the questions, you know, having them reply to each other, but it was more my lead. And so then the next discussion board we did, it was on them. And so I, you know, obviously chimed in if I needed to, but they actually had a task where they watched The Last Emperor, which is a movie that has a lot of cultural background on China. So they had to watch the movie separately and then come together and discuss the movie and ask each other questions about the movie. And the discussion board turned out very meaningful for all of them, to the point we got feedback afterwards of they preferred that discussion board over the one that I had led, because they did get to know each other a little bit more. And they got to ask the questions. They didn't have to answer my questions. So I think they really did like that. So those are a couple of things ahead of time to get that interprofessionalism built before we actually got to China. And then another thing with the follow-up too, like Dr. Moose said, they are required to do a interprofessional seminar about their experience when they come back. So then they have to, you know, create a combined presentation that gets presented to anybody. It gets sent out to anybody that is wanting to come and get to know what their experience was, get to know how CHIP is handled and what they learned from CHIP. So the actual experience in China is 10 days. We leave Omaha, and there's a 13-hour time difference. So we kind of lose some time on the front end, gain it back on the back end. But we leave Omaha, fly into Beijing. It's usually the usual place we fly into. Stay overnight in Beijing, and then head out to the Hebei province, where we actually will be in the medical clinics there. And so once we get to Hebei, there's a symposium that is completed with all of their medical professionals, where any of the faculty that have gone on that trip will present a symposium, and then they have medical professionals that will drive in from all over China to see our presentations. And then they usually pick the topics for those. So that's kind of how, we address their needs as well, is we allow them to say, okay, what things are you guys really needing to learn about or want to learn about? And then our faculty go in and present those things. So that's kind of the first day we're there, starting off. And then we go into the clinics. And in the clinics, we present, the students usually do a presentation. In the past, it's been, to the clinicians in the clinic. And so our students will present to the therapist on topics that they want to know about. This year, our students actually presented at the medical university to the students sitting in the classroom. So they got that interaction with the Chinese students as well, as then they also got the interaction with the therapist in the clinic. So we spend 4 days consulting in the clinic. We will be up on the floors with them. We'll be down in clinic with them. We see many different patients. Like I said, nursing gets to kind of go in the medical facilities a little bit more. We get to see all the medical facilities. We get to go through all parts of the hospital, the pharmacy, all those different things, just to really get a grasp of their culture and what their medical facilities look like and their system is. When we're in clinic, we're consulting with the therapist and with the clients. They usually have clients that they've had for a while and they're not making progress, that they want us to consult on. What should we try now? What would you guys do? That's a pretty common one. Or they have clients that have just arrived there and they're saying, oh, where should we start from here? In the Hebei province, there is actually historically not been a distinction between physical therapy and occupational therapy. But now they are starting to make that distinction. So their medical university is now trying to move into an OT degree and a PT degree, which before it was just a rehabilitation therapist degree. So this past year, consulting was really fun because they asked us a lot of questions on those distinctions and what should one be learning in school versus the other. So that was something we were looking at too. So this is just pictures from the symposium. And you can see Dr. Bradbury and Dr. Fry and Dr. Mu have all presented, and then what other faculty presents as well. And so this is a picture from a student presentation, and you can kind of see that there's usually lots of interest. They ask a lot of good questions. There's a lot of consulting we can do. There's a lot of education and information we can leave them with that they can also use in the future.
Yeah. Okay. The next we are going to talk about the outcomes or evaluation, right? Especially related to interprofessional practice. We know that for any programs, we always do conduct evaluations, right? In terms of formative and summative evaluation. So we have been doing that since its insertion in 2008. So the first time I still remember when we went, we have 4 OT students, 4 PT students, and then 2 nursing students. It's a bigger group. So we came back and then we began the evaluation of the program assessment piece. So one of the things really stood up, that was interprofessional work. And then students said, oh, we really value the experience because we began to know each other. We work together, we gain more appreciation and the values of each other, different professionals' contribution. So that was great, really stood out. And then in my mind, I was thinking, I said, oh, that's great. However, that means that we probably have more work to do. We don't have to, right, fly 1,000 miles to learn interprofessional work. Right. So when you think about, right, that's like 10 days. I mean, there's a cost, right? We have this all the preparation and just want to learn interprofessional education. So can we do something better, right? Domestically, right? So and then that was my initial thought. But then along the way, I began to realize this experience is very unique. The reason is because really when you think about interprofessional education, probably not just starts when people in the classroom, when people began to work on cases, right? Like Professor Patterson mentioned that when students work on the presentation that they bring to China, when they work on that, they use lots of case studies. They use our OT process, PT process. So during this stage, what the OT can do, what the PT can do, right? So I think the interprofessional education piece does not start with the student get together to work on the cases in the classroom. Why I began to realize that when students began to travel on the airplane, they have lots of communication, right? When they are on the bus, right? When they are on the train, it's very informal, but it's still part of the interprofessional piece. Also reminded me, our school has had a lot of services in the Indian reservation, like a Winnebago, right? So we have, the school van, right? We bring students from OT, PT, go to the Indian reservation to engage in service learning and so forth, experientially. So we wrote an article and it really came to me as the interprofessional interaction, interprofessionalism does not start when they come together to work on assignment. It starts their trip, right? When they were in the van, they talk to each other, they learn about each other, they began to build these team working skills. So in that sense, I said this experience is unique, just like other experience, right? So when people are just in this informal setting, that plays important piece in the interprofessional education teamwork. So in my mind, I always feel like when we think about interprofessional work, there were, I think for students or for faculty too, right? There were two areas that's essential. One is that as a student, we need to understand our own profession well, which means that we know the scope of practice, we know as an OT, right, scope of practice, roles, responsibilities, right, professional standing, all this. We have to understand our profession very well. The other piece is like the teamwork, right, how to work with others. So that's essential as well, right? So the teamwork, the skill like communication, respect, right, understanding of each other, value the contribution, the uniqueness each professional, each student brings to the table. So that two pieces I think is very important, right? Really, truly understanding, grasp our own profession, but also to appreciate, right, value the contributions of others. So in order to achieve that, right, again, it's not just in the classroom, maybe all the informal interaction, right, communication that really helps with the interprofessional team. So that's kind of really happened during this immersion experience. We also did a formal study, right? We always conduct all these evaluations. We started 2008, however, the formal data collection, the systematic data collection started 2009. So we use both quantitative, qualitative, data collection techniques, right? It's a mixed method approach. Some of the skills, I'm sure if you're interested in the interprofessional education, you probably recognize, especially the first one, IEPs, that has been used in lots of research studies, studied in nursing. The team skill, I know our projects with Winnebago, the Indian reservation, we use that quite often, and then also the culture competency practitioner assessment. So that's the quantitative piece, and then also we have the qualitative piece, right? Really, we unique in a way that we will talk about reflection, right? That's the Ignatius value, one of them. Also, our kind of a judge was pedagogy, right? Really talk about reflective piece. We have an open-ended question for students to reflect on. We also ask them to write in writing to answer some of the questions. We also have the open questions for students to really have a chance to express their views and perspectives. Focus group as well. So, and then we did a pre-post test. If you see from the results, quite a surprise that even though we found that in the past, right, the experience has an impact, we found a significant difference between pre and post test. But however, for this study, we found that the difference is obvious from descriptive studies. However, the inferential t-test, we didn't see the difference between pre and post test on the IEP and in the teamwork. However, in the co-chair competency scale, we found a significant difference. The qualitative research data really pinpoint the impact on interprofessional work in co-chair competency. So here are the themes we found based on our focus group, based on our reflective note. Right? For example, students began to really realize, oh, there are different ways in life, in the world, right? Particularly, for example, in Western culture, we really emphasize independence. In the Oriental area, many countries seems that they're more focused on the dependency each other. So the family contribution, the members of each family member, their contribution to the family is so significant. So just kind of an open, the horizon, right, the window for a student. The second one, like again, we mentioned earlier, is really stands out. That would be the interprofessional piece. So they began to say, oh, we began to see the value every member brings to this kid, to this difficult case. And then instead of think about the tough wall, right? So this is OT, PT cannot touch. This is the PT, OT cannot touch. So they began to see, oh, when we group together, this is what the OT is going to do, this is what the PT can do, and then they help each other out, and then nurses as well. This is really for their professional growth, right? Teamwork, negotiate as a team, right? When you think about the concept of team, there's a common goal there, right? We want to achieve something, everybody can contribute to it. So, in this situation, it's quite unique because the resources is very limited, right there. So they bring in a patient, like Professor Patton says, very challenging case. So they bring a patient and introduce the patient and then describe a little bit history. The documentation is not very thorough there. And then they turn around to our OT PD students, what can you do with this patient? The OT turn around and say, oh, I want to find the gate valve. But then they cannot find. Right? And then they turn around and say, oh, maybe it's good to have a therapy band so the patient can work on. They look around, they couldn't find. Right? Or maybe a therapy, I don't know, maybe like a Sprint, right? Or universal car or something. They look around, they cannot find. So what do they do? So everybody gather around looking at you. What do you do with this patient? Right? So in that case, when you think about OT student, how to maybe think about, oh, as a PT, what do you do in this case? Right? What's the PT student probably ask the OT student, what do you do? Right? Especially with the resources is very limited. Especially the practice there is very, very different from here. So that really provides challenging, situation and opportunity as well for them to really work together, to rely on each other, especially when 20 people just stare at you, what do you do? Right? So that, when you think about, has dramatic impact on their professional, interprofessional development. Student participants value that. unique experience, right? We talk about a lot. They began to understand the culture, the healthcare system in China. So I think that's kind of the outcome from the quantitative, qualitative data collectively. We feel like really has impact significantly on their culture competency, interprofessional work, team work skill as well. So that's kind of our finding. Of course, for any study, we know that we also look into the limitation. The non-significant finding may be due to really the small group we had, right? Even though over the number of years, the number is still small. Maybe that instrument lacks sensitivities. And then next time, we don't have much time. I'm going to just very quickly mention the where we are going from here, basically. So like Professor Patterson mentioned that we began to expand the chip to other professions, right, including medicine, pharmacy. Every year we receive emails from especially pharmacy students and say, oh, this great opportunity, can we participate? In the past, we limit to really OT, PT, nursing. But now starting 2016, we will have a pharmacy medical student participate. We have a lot of partners in China. There are 5 MOUs with different hospitals, different universities we signed. Right? They can be, all these sites can be experiential learning, service learning for our students in our interprofessional nature. They include short-term, long-term students, faculty as well. For example, this last summer, we hosted a group of students from Shanghai, OTPT students. We hosted like a visiting scholars. This coming summer, we will have 10 students from Shanghai, OTPT. They can work with our students here. And they also have 5 students from Kunming, from China, OTPT as well, to work with our students. So really in interprofessional nature. So that's kind of what I just mentioned. Because all this collaboration, this is exciting. Over the next 5 years, we will have 20 therapists from China. They will be enrolled in our entry-level OTD, entry-level DPT. They want to get our professional doctorate just by kind of as a kind of a result of all this collaboration. We are developing a master program to help educate OT PTs in China, use our distance hybrid education. So that's quite exciting. So we try to incorporate whatever we do, the interprofessional education, interprofessional practice piece. Always we want to thank everybody for their contribution, right? It's not just Angela, myself, right? Over the years, lots of people contributed. The study I just described, we have a lot of faculty members who contribute, like OT-PT faculty, so we want to acknowledge that. It's exciting that also like I mentioned, the therapists from China to get a degree here, OT-PT, very likely we will have a pharmacist. They will come to Creighton, to our school, to get a pharmacy. So we are talking about that. I'm sure eventually it will be in medicine as well, right? So we really began to see the interprofessional piece. So I think this is exciting. Again, it's just one piece we feel like is very important in terms of interprofessional. There are other ways as well, right? I'm very excited because I remember in 1999, so I started in 1998. In 1999, our student in OT said, oh, we have a school of medicine, we have a school of nursing, we have OT-PT pharmacy. Can we do more work interprofessionally? Right? So think about that was many years ago. I said there's a push right now from all the professions, right, to emphasize, value the interprofessional education practice. I said with that, any question from you? I know I will push back a little bit. Anything? Oh, yeah, go ahead.
How did you address the language barrier with students?
Oh, very good question. Language. right now China, if students, if therapists, they have undergraduate or graduate study education, their English is pretty good. It's still limited, but they can communicate.
Right.
So and then if needed, we always provide translation.
Okay.
So but they can talk English.
But I mean, working with patients in any capacity, did they have English skills as well, or was there always an interpreter?
We have an interpreter, but also we have the Chinese therapist. They can translate. Yeah, very good. Yeah.
So these short-term 10-day trips, how do you guys ensure that you're not at all a burden to the community?
To China.
Yeah, to the whole community there.
Oh.
Or how do you build trust with the patients when you're only taking them for such a short period of
Oh,
time?
very good question. The question was like, how can you just there for a short time? How can you build the trust, right? That was very interesting question. Two things. One is that in Chinese culture, so there's a hierarchy. The respect to professionals is always there. So if you are a professional, especially you come from overseas, they respect, they basically believe in everything you said. So that's one piece. But also another thing, we always have the Chinese therapists, physicians around. They know, I mean, there's a trust there. Very good question. Okay. Okay, thank you again. Appreciate your time.
Thank you, Dr. and Professor Patterson. We'll get going to the next session, but if you could quickly drop these evals down by me, that would be awesome before you run off. Thank you all.
Oh, yeah.